Okay, great. Thank you very much, Marvin. A quick check. Can everybody see my slides okay? Okay. Well, first of all, it's an honor to be with this panel, with you, Marvin, with the team, and with the potential investors to share a passionate carotid stenter's perspective on this technology and also from the IDE trial going on in the United States. Here are my disclosures. Again, importantly, I am the national PI for a trial in a compensated role, and I've been the PI for other carotid stent trials as well. I can promise this is from the heart, not from the wallet, my discussions here. So it's important background. As Marvin mentioned, but now for the first time we see a definite trend towards carotid stenting, away from endarterectomy, even from vascular surgeons with TCAR and carotid stenting. There is a lot of carotid disease out there, and as everyone knows, patients are terrified of themselves having a stroke. Carotid stenting, as mentioned, has had some issues with minor periprocedural strokes. An ideal carotid stent is needed to reduce these types of strokes, conform to the anatomies of the vessels that we treat, and to be usable whichever way we choose to get to the carotid, whether it's TCAR, transfemoral, transradial, etc. So our goal, of course, is carotid stenting performed safely without any periprocedural stroke. It's very important to realize that the majority of strokes after carotid stenting don't occur during the procedure, but rather in that short time interval after it, okay? And what that means in various studies is that the more the cell is open, in other words, the biggest size in the stent pores, the more likely that that plaque is able to get through the stent later and then go upstream, even though you had a nice result. Marvin showed this is a standard stent over here, and you see the coverage is not so great. And even though the stent looks good for most of it, there's that little plaque protrusion at the arrow. So even though the angiogram looks good, the brain does not look good if some of that material extrudes, gets through the stent after the procedure, and gets to the brain. Now, what would be an ideal carotid stent? It would conform to the majority of the vessels that we treat, and yet maximize plaque coverage to reduce particles that get up to the brain on a later basis. Well, the available conventional stents that we've had for years are either open cells. The great thing is they're conformable. They'll go around bends, but they have the least plaque coverage. Then there are closed cell stents. The coverage is better, but these are more rigid tubes and less conformable. And as you'll see, it's still not ideal plaque coverage. The Seaguard Micromesh carotid stent may be that ideal stent, covering this micromesh layer that we'll look at on a conformable stent. It may combine the best of two worlds. It's extremely conformable, as well as anything that's been out there through that proprietary SmartFit technology, and yet has by far the best plaque coverage through the micromesh layer with the smallest stent cell size that's been seen to this date. So here you see this conventional stent in the metal struts covered with this much smaller micromesh layer that's on the outside of the stent, which is important on this conformable design with increased coverage. You've seen this is just a conventional stent, and sewn on the outside is this micromesh layer. You've seen the SmartFit technology, but what I will say is that now you don't have to have a taper with a 7mm one side, 10mm the other, and then a twist of things in between. You can have one stent that itself will conform to both ends, as he said, reducing the inventory that we need as physicians and Sean Line and others need as supply chain directors. This is a good thing. Despite this conformability, it has unbelievable plaque coverage. If you look here, the open cell, this huge circle, closed cell is the best we've had. Look at that size. The other two micromesh carotid stents are here, and then in green is the Seaguard. And if you look at on a graph over here, you can see how much smaller the pore size is, the opening here to let plaque not get through is what we're trying to do. So going back to our initial picture, you start with this plaque protrusion through the metal layer and replace it with the same picture without plaque protrusion because of its extra insulating layer or protective layer. Now, there are two other micromesh stents. In Chris's opinion, I've been in all three of the trials. I think this stent has advantages. It has an increased conformability with kind of an auto tapering, okay? It's an exact stent. A 40 millimeter stent is a 40 millimeter stent, as opposed to others that greatly elongate where you don't need it. The mesh sizes are smaller, the pore sizes are smaller, and it's on the outside of the stent, so it's not infolding inside the stent, and there's no coating on this. In the data, long-term data, it has a lot less restenosis or occlusion compared to the others, and durable data. It's easier to size and deliver, and there's a large matrix of stent size available and no supply chain issues. We've looked at this, but it is important. Again, this is a slide Marvin's shown, but as a doc, when you really, hey, I can show you great animations, but we want to see data. And the bottom line is, in 27,000 implants and 1,600 in rigorous clinical trials, you can see durable results out to 5 years. And again, this is where we see the advantages against the other stents. Again, you've seen this slide as well. This is not a direct comparison, but this is the conventional stents and surgery in the CREST randomized trial in the New England Journal. So this is very carefully adjudicated data. And you can see the C-guard performs very favorably, and no major strokes seen with this protection against plaque protrusion. A brief word about the C-Guardian's USIDE pivotal trial. This is for U.S. approval for CMS and others. We've done this very carefully. Christina Brennan and others and Marvin have done a great job with this. We require either the NAV6 distal protection, the best in class for distal filter protection, or the MoMA proximal protection. Those are the only two you're allowed. We know these are the best protection systems. The sites and operators are very carefully selected. Cases must be approved by an experienced screening committee to get into the trial. So we're not letting bad cases into the trial. The protocol has been carefully prepared and undergoes revisions on a regular basis from anything that we learned that wasn't perfect. We review the cases after they're done. And so what you have is what I think is an excellent stent combined with an excellent study with experienced sites, operators, mandated procedural techniques and the right technology, and carefully selected and reviewed cases. Here's one of our cases in the trial. You can see the aortic arch here. You can see very slow flow on that red dotted arrow in the left carotid system. This is a severely symptomatic patient. You can see how tight at the red arrow the carotid is. You really want protection for this kind of person who's already thrown little pieces to her brain. Look how slow the flow is getting to the brain in the dotted arrows. That's at baseline. So here's the proximal protection system. This is a balloon in the external carotid. We're going to shut the blood supply, and in the red circle, you'll see me steering a 14,000-inch wire in a protected fashion, okay? With the protection, we do a balloon, and then in the red dotted arrow, this is a C-guard being released, and it comes out into the carotid artery. This is that stent, and then we inflate a balloon within the stent, and here's the final nice result with the protection of the micromesh to prevent any of this from getting up to the brain now or later. And look how brisk the flow is compared to what I showed you before. You know, this patient right after this was asking me immediately for a calculus book, which we had to deliver to the bedside. I may be exaggerating slightly, but the flow was a lot better. So if I was an investor, I'm a plumber. So this is up to you guys. But if I was an investor, why would I consider investing here? I think it's an awesome stent. I believe it, and it's got a lot of data and experience already with more accumulating. The company is a nice company. When you have savvy leadership and yet they're user-friendly, you all know, and we know as docs, it's nice to have that combination of user-friendliness. I believe it's there. There's a potential that CMS is currently reviewing the national coverage decision so that we may even expand coverage for carotid stenting. That comes, we have a predictable IDE trial that's ongoing. Now, predictable is in air quotes, but we've designed it to be a win for the stent because it's a good stent and done correctly in a good trial. Again, there's already an increasing trend toward carotid stenting, even amongst the vascular surgeons. Couple that with increasing reimbursement options, it may be a very good time. And again, this stent is going to be designed in such a way, and again, these are the forward-thinking statements, so it could be compatible with TCAR, which the vascular surgeons are embracing, or from transfemoral, and there are other new indications and devices being tested in their technology pipeline. So in conclusion, InspireMD has a very unique stent and a lot of suggestions that it will be the best-in-class carotid stent. There's already excellent experience and data long-term for this, and the U.S. pivotal IDE trial is enrolling well with very favorable results to date and expected to continue with favorable results. Increasing trend towards carotid stenting and potential increases in reimbursement, in my opinion, make this a unique time and opportunity for mutually beneficial partnerships amongst all of us. And I thank you very much to any Steeler fans out there, and look forward to any questions in the session later. So thank you very much. Oh, and with that, it's going to be a pleasure to throw the slide deck over to my good friend and colleague, Dr. Adnan Siddiqui, neurosurgeon and one of the better interventionalists in the world for both stroke prevention and carotid, vast experience. So Adnan, I'm going to pass the baton to you, my friend.